The topic of our conversation today is helping you prepare for Medicare. So we do these meetings in our conference room that's in our office off of Columbiana Road. Today's conversation is not a full dissertation of Medicare. Those typically last about 45 minutes to an hour, and then we have some questions and stuff after those. This is sort of just a high-level view of Medicare. So how many people have ever seen this book, Medicare and You? So it's been around for a long time. The truth is that Medicare is not as complicated as it seems. There are a lot of moving pieces related to Medicare, and this book has all the answers. The problem is you don't know what questions to ask, because most of us go to work and we're employed, and our employer provides our health benefits, right? So then all of a sudden we retire, and two things are happening. I'm being bombarded with information through the mail, through the media, through whatever, about you must do something or you'll be penalized. But then I'm also an intelligent person who's trying to make a long-term decision about my health insurance with no experience to make those decisions. And you're relying on friends and family and people, and you're susceptible to being sold things, right? Because when you meet with someone who's an insurance agent like I am, somebody may try to sell you a product. So I used to work for insurance companies. I worked for Blue Cross for a long time. I worked for Viva for a long time. And then some years ago, I decided, you know what? Everybody needs the same thing, which is education, right? Regardless of what company or what product, everyone needs the same thing, which is simply just, what do I do? And to get that education, what you need more than anything is to trust the person who's educating you. So you'll make sure that you're getting the right information. So to tell you a little bit about our company, so Medicare Advisors of Alabama was founded in 2017. Our office is on Columbiana Road, right down from Shades Mountain Baptist. So if you guys know where Berry High School was, because we've got some folks who went to Berry, but now it's Pizzitz Middle School. So we're right in between Pizzitz Middle School and Shades Mountain Baptist. We're an insurance agency. We represent Medicare plans throughout Alabama and also some surrounding states. But primarily we do things in Alabama. But we also do more than just Medicare. We help people with marketplace insurance. So a lot of people who are retiring now have a spouse who's under the age of 65. We help with marketplace, or what's also known as ACA insurance. We help with that. We also do some dental and vision. We dabble in life insurance a bit, and also some international travel insurance for people who are taking trips and need some international travel insurance. We're not a part of the federal government. We're a local insurance agency. But to contact Medicare itself, you just call 1-800-MEDICARE or go to medicare.gov. So this is our team. So we have a nice looking group. Most of these guys are at the table here. So me, Philip Richards, Dana Garvin is the lone person who has to answer the phone while we're on a field trip. And then Debbie and Tricia. So we all think of ourselves more as Medicare educators who happen to have an insurance license. But one thing I was mentioning earlier, we are insurance agents. So how do we get paid? This is a really important question so we all can be transparent. So we never charge fees. Our revenue is generated from commissions paid by insurance companies that we're contracted to represent. But commissions are regulated by CMS. I'll say CMS quite often. It's the Centers for Medicare and Medicaid. Those commissions are regulated, so there isn't an incentive to recommend one plan over the other. We represent the vast majority of every option that you have related to Medicare insurance. And our mission, our goal, is to simply live the golden rule. Just provide a valuable service. I always tell a story. I'm not a very good plumber or an electrician or a candlestick maker or any of those types of things. I just know a lot about Medicare. But I rely on people who come to my house to do work, to be honest and transparent and help me make a good decision. And sometimes you get somebody who comes out and says, this work will be $2,500. The next person comes out and says, it'll be $500. And I'm like, I'll take the $500, please, but tell me the difference between that. So you just want to have some transparency and trust between everything. So let's kind of get into a little bit about Medicare itself, and that way you guys know what I'm actually here to talk about. So Medicare is a federal health insurance program for people who are 65 years of age or older, or younger people who have disabilities, and also people with end-stage renal disease. So it was created in 1965 as part of the Social Security Act. And today it's made up of 4 parts called A, B, C, and D, which we're going to talk about in just a second. But don't confuse Medicare with Medicaid. So Medicaid is a state-based program that helps people with limited income. Some people who have very limited income can have both Medicare and Medicaid. So for example, if you're living on $900 a month Social Security check, that's your total income, you could have Medicare as your insurance and Medicaid helping you pay for the insurance. So you can have both Medicare and Medicaid, but everyone is eligible for Medicare as long as you're a U.S. resident and turn 65. But you can get Medicare early, be younger than 65 and have Medicare if you've been disabled for more than 2 years and been on Social Security disability for 2 years. So when should you start thinking about Medicare? You can think about Medicare anytime. I think about Medicare all the time, and I'm 47. So around the age of 64 is really when you want to start thinking about it, or perhaps earlier if you've been on Social Security due to a disability. And also just when you're considering retirement. So if I'm considering retirement and I'm not 65 yet, 65 is the magic age. That's when everyone becomes eligible for Medicare. But I may not want Medicare at age 65. But what happens is people tell you that if you don't enroll, you're going to be penalized, right? You better do something or you're going to be penalized. That can be true, but it's not always true. So if you or your spouse are still working and maintain health insurance through your spouse's employers or your own employer, then you can delay enrolling into Medicare until you decide to retire with no penalties. The key to Medicare is understanding that the government doesn't want to penalize you. They want to make sure that you have health insurance. So I'm 65. I'm becoming eligible for Medicare. I'm actively working. I have insurance through my employer. I'm happy about that. I don't want anything to do with Medicare. You don't have to do anything related to Medicare. It could just go right past, and then at some point, you could apply for it when you get ready to retire. The vast majority of the people, though, go ahead and enroll into Medicare Part A. That's the hospital part, because there is typically no premium for Part A. We'll have a slide on Part A in just a second, but a lot of people will say Part A is the free one. Just to let you guys know, nothing is free, even our lunch, right? So everything has a cost to it. Part A, you pay for throughout your life as you're working through FICA taxes, like we were talking about a few minutes ago. You earn Part A at no premium after you have been working for at least 10 years. But what if you move to the U.S., become a resident, you are turning 65 years old and you've lived in the U.S. for 5 years, you're a resident of the U.S., but you never paid in, you're eligible for Medicare. You just have never paid in. So Part A for that individual will be $504 a month. So a lot of people think it's free, but that's what we're paying for throughout our working lives. But the other thing about Medicare Part A is, what if I have a health savings account? My employer offers me a high deductible health plan, and I contribute to a health savings account. And I want to put my maximum amount of money in my health savings account. That individual doesn't want Part A because things get really complicated from a tax perspective, because now you're taking a government benefit and also not having to pay tax on the contributions that you're doing for your HSA. So that individual is better off just contributing to their maximum part of their HSA, putting money into this fund, and not enrolling into anything until they get ready to retire. And then we can help with that, and we'll get into some more details about that. So let's talk about these 4 parts of Medicare. So we mentioned Part A just a second ago. So our Part A is hospital insurance. That pays when you go into a hospital, skilled nursing facility, or hospice. Part B is the part that we're all familiar with. Part B is the physician's portion. Part B covers your primary care doctor, it covers your specialist, it covers outpatient surgeries, it covers home health and medical equipment. So Part B does the heavy lifting. Now, I get questions all the time about, why are there parts? Why do they make this so complicated? So it is complicated, but healthcare is complicated. Life is complicated. Why is life so complicated? So when we talk about A and B, really just think about, where did health insurance begin? Health insurance began with insurance companies, and I'll just use Blue Cross as an example. Health insurance began in the 20s with a company like Blue Cross, who went out to hospitals and contracted with the hospitals. And employers would pay Blue Cross to negotiate with the hospitals, and those employees could simply just go to the hospital. Blue Shield was a different company. Blue Shield went out to private practice physicians and said, hey, would you contract with us, reduce your rates, and we'll have this employer group bring their employees to you because you're one of our providers. And you had a precedent that sort of was set many decades ago of hospital benefits and physicians' benefits. Now, I'm simplifying complex stuff here. But you fast forward some decades, and when Medicare started, they didn't invent the wheel. They just basically did what was already established, which was having hospital insurance and physicians' benefits, Part A, Part B. Nothing was added to that until the late 90s. Early 2000s, late 90s, Part C was added. Part C, just to read it, is a Medicare Advantage plan. It's a type of Medicare health plan offered by private companies that contract with Medicare to provide all of your Part A and Part B benefits. Most Medicare Advantage plans also offer prescription drug coverage. Your Medicare services aren't paid for by original Medicare. How many people understand that paragraph? No one. Perfect. So we can go to some other slides. That's what we're going to talk about a good bit here in just a second. Part D, that's your prescription drug coverage. That was passed in 2004 and went into effect really in 2006. So just to kind of help you understand, we have these two parts, A and B, hospital and physicians insurance. We have this thing that's called Part C that was created in the late 90s, and then we have this thing called Part D that happened in 2004. So Medicare just happens over time. This is my favorite page. So I'm going to spend about 2 hours on this page. I'm just kidding, just seeing if you guys are still awake. These folks at this table know I can spend 2 hours on this page. But I call this page a Medicare skeleton. And the reality is that there's 4 parts to Medicare, but there's really just 2 options. So the number of insurance companies that advertise to you, the number of agents like me who advertise to you, everyone's talking about these 2 options. And it's really simple. You have a traditional Medicare system, and that's what everyone is familiar with. So when we talk about Medicare, A and B, what happens is, without getting into a whole lot of detail about it, when I show up at the physician's office, Part B, the physician's portion of the insurance, is going to pay 80% of my physician's claims, and I, as an individual, am going to owe 20% of that physician's claim. Very simple. The problem is that there's no cap to what that 20% could be. So it's 20% to an infinite number. So if we're looking at 1965, 1970, 75, maybe 20% isn't a lot. 2024, I don't know what 20% could be. 20% of surgeries could be a whole lot. So when I have traditional Medicare, I mentioned earlier, Part A has no premium, but Part B definitely does. So Part B's current premium is around $175 per month. That's also based on your income. So if I'm retiring and my income as a couple is more than $200,000 a year, I could look at having to pay more for Part B. When we meet people in our office, we get into a lot more detail about that to also help people understand that that extra amount of money that you pay isn't forever because your income fluctuates. And if you're retiring and you've made a good bit of money prior to becoming eligible for Medicare, you can fast forward a little bit in time and let Social Security know that you've left work, and there's a form that you can complete to reduce that amount of money. So we help a lot of people with that, just